by thanking Western Australians for overwhelmingly doing the right thing, following the public health measures, getting tested and getting vaccinated. Yesterday, 31,551 people came forward to get vaccinated, including 14,067 in our state-run clinics. 9,117 of those were third doses. Now, this number does not include those who got their third doses at GPs or pharmacies, so that is an outstanding result. Yesterday, the wait time for third doses reduced from 5 to 4 months since your second dose. As a result, we are seeing a lot of more people coming through our clinics. From next week, the 5 to 11-year-old cohort also becomes eligible for their first vaccine, which means we can expect our clinics to be busier than ever. It is vital that people book ahead to ensure that people are spread out evenly across the day. The Vaccine Commander will have more to say on this shortly. It is fantastic to see so many people rolling up for WA at this time of the year. While it is easy to focus on the minority, acting selfishly and trying to create division, so many Western Australians are keen to do the right thing to protect their loved ones and the community at large. Yesterday, we did 6,179 COVID tests. I can advise that overnight, WA has recorded 16 new cases of COVID-19. This includes 5 new local cases in total. 3 are related to the Delta backpacker cluster. 2 of these cases are considered to have been infectious while in the community. And this includes the 1 case announced yesterday linked to the 2 exposure sites in the city, being the Lucky Shag and the Avery Bars. 1 of the other local cases is not part of the Delta backpacker cluster and is a hotel quarantine worker at the Hyatt Hotel, and an investigation is underway into this case. We can confirm this case was picked up on a routine daily swab, and therefore we expect the number of exposure sites to grow, but to be limited. Any close contacts of the security guard are being tested urgently. The 5th local case is a household contact of a recent interstate arrival who is currently quarantining at home and was previously announced. There are also 7 cases related to interstate travellers, 2 cases related to returned overseas travellers, and 2 cases related to aircrew. All these cases are in quarantine. While investigations into these cases are continuing, we should be prepared for new exposure sites to start appearing soon. Late yesterday, exposure sites were updated to include the Lucky Shag and the Avery Bars. If you were at the Lucky Shag on Wednesday the 29th of December between 1:30 p.m. and 11 p.m, and on Friday the 31st of December between 11 a.m. and 3:30 p.m, you need to get tested immediately and isolate until you receive a negative result, unless directed otherwise by WA Health. If you are at the Avery Bar on Thursday the 30th of December between 6:30 and 10:30 p.m, you need to get tested immediately and isolate until you receive a negative result, unless directed otherwise by WA Health. A further 9 new low-risk exposure sites have been listed online this morning. This includes sites in Perth, Mount Lawley, West Perth and Greenwood. We also have a new site in Broome. This site is related to a person who worked offshore and has since returned to Queensland and subsequently tested in Queensland. These sites are deemed low risk in that people are required to monitor for symptoms unless otherwise advised by WA Health. Please head online and check the exposure site dates and times for these locations. It's important that we keep checking the exposure sites daily and follow the health advice against each site, as they are regularly updated as new information comes to hand. Not to mention, checking in on Safe WA. Yesterday, Safe WA recorded 1,834,952 scans, a 37% increase on the day before. This is fantastic and we need to keep it up. The Safe WA app is an efficient and safe way to assist contact tracing if it is required. As of this morning, 787 close contacts in total have been identified in the Delta backpacker cluster, 12 of whom are yet to be tested. 775 of these close contacts have produced a negative result. There are also 1,464 casual contacts, 1,245 have tested negative, and 214 are yet to be tested. In regards to the vaccinated quarantine hotel security guard from the Pan Pacific, I can advise that the genomic sequencing has shown he is infected with the Omicron variant. While this is serious, in encouraging news, it does not appear that there has been any further spread. 15 close contacts have been identified, with 14 negative and 1 test pending. 8 casual contacts have been identified, with 7 negative results and 1 test pending. Investigations are still ongoing into how the infection occurred. Today, I can also provide an update on WA's border controls. With case numbers dramatically increasing in ACT and Tasmania, the Chief Health Officer has recommended these jurisdictions be elevated to extreme risk. As of 12:01 a.m. on Saturday, the 8th of January, Tasmania and ACT will move from high risk to extreme risk. This means travel will not be permitted between WA except in extraordinary circumstances. Exemptions will be limited to approved travellers who meet the following criteria: Commonwealth and state officials, members of Parliament, diplomats, and specialist or extraordinary circumstances determined by the State Emergency Coordinator or the Chief Health Officer. Approved travellers are subject to the following conditions, unless otherwise advised: be double dose vaccinated against COVID-19 if eligible. Receive a PCR test for COVID-19 within 24 hours of arrival. Undertake hotel quarantine at a state facility for 14 days at their expense, and get tested for COVID-19 on days 1, 5 and 13. So if you're in Tasmania or the ACT with an approved G2G pass, come home now before it is too late. From 12:01 a.m. Saturday, the 8th of January, all jurisdictions except the Northern Territory will be classified as extreme risk. Yesterday was the first day of the new public health measures, specifically wider requirements for proof of vaccination at higher risk venues and events. The feedback so far is that venues and punters have adjusted well to the new requirements. I'd like to pass on my thanks to patrons and venues for adapting so quickly to these new measures. Obviously, everyone knew that this was a possibility, as it is effectively what would have been in place under our revised state transition plan. And it is pleasing to see so many venues and patrons already making the switch so quickly. So just to remind everyone, these higher risk venues and events covered by this policy include nightclubs, music festivals and major events of more than 500 patrons where mask wearing will also be required outdoors, pubs, taverns, hotels, and specialty facilities with more than 500 capacities or trade after midnight. Events with an occasional liquor licence and the Crown gaming floor. There are a few ways attendees can show proof of their vaccination in both digital and paper-based form, along with their proof of ID. WA's new app, which encompasses proof of vaccination and Safe WA, will be available from next week, which will provide a more secure and efficient way of showing your vaccination proof. But it is still but it will still require you to take steps like having a certificate on your MyGov account, so it is best to get started now. And finally, proof of vaccination is a shared responsibility, shared between the venue and the patron. Anyone, venue or patron, deliberately doing the wrong thing will face consequences. The vaccine commander will talk more about this shortly. With the detection of cases as part of the Delta backpacker cluster, it's so vital that this cohort linked to known cases or have frequented places with this group get tested immediately. Keep checking exposure sites and monitor your symptoms. We need these people to come forward now, and we urge you to do this immediately, as we do not want to hold back the WA community and have to lock down these types of venues. Owners and operators of backpacker hostels, I urge you to work with the authorities to ensure the backpacking community can be tested urgently. On rapid antigen testing, from next week, the Chief Health Officer will lift the public health ban on the use of rapid antigen tests in WA. We're finalising the exact guidelines around the use and will announce further information ahead of the ban being lifted. This will give businesses, retail outlets and people more certainty going forward. You might be aware of discussions around rapid antigen test use across the country, and this is something that the National Cabinet is working through as we speak. This includes who is eligible for a free rapid antigen test, and I suspect the Prime Minister will clarify those matters once the meeting has been finalised. In conclusion, can I say over the past 2 weeks, Western Australians have done an exemplary job. In blistering heat, they have come forward to get tested, followed the public health measures, kept getting vaccinated, and adjusted to the new proof of vaccination requirements. It's that kind of attitude, the patience, the flexibility, and the willingness to put others first that has driven WA's fantastic performance through the pandemic. So I'd like to thank everyone for their efforts and simply urge everyone to keep up the effort to make sure that we can continue to control this pandemic. And I'll hand you over to the vaccine commander, and then we'll take questions.
Good afternoon. I'd like to also add my thanks to those West Australians who are doing the right thing by being vaccinated and taking all those public health measures such as wearing masks while we go through this particular challenging time. Today, over 64,000 people in Australia are recorded as having new cases of COVID. Obviously, in Western Australia, it's far different, but we do expect that it will enter Western Australia and have a big impact on us. So I want to thank those people who are on the front line that are administering the vaccines, the nurses, the doctors, the police that are checking right across the state in some of our most remote and hot areas to protect all West Australians. There are also people at our 13 COVID line who have taken over 1 million calls since April 2020 and they are answering a lot of the questions that the community and businesses do have. It's a challenging time for people and business owners, and we know that if we all continue to cooperate and work together, we can equally protect each other. And the vast majority of people are doing the right thing every day. In terms of vaccinations, now 93% of West Australians aged 12 and over have now had their first dose of a COVID vaccine. 85% of people in Western Australia aged over 12 are now double dosed. And pleasingly, as the Acting Premier has already outlined, now some 10% of eligible Western Australians, that's over 203,000 people in WA, have now received their booster or third dose. So look, while I've got a role as a vaccine commander. I'm not a medical expert, and I've been taking advice, as the government have, from the Chief Health Officer right through the last 2 years. And the health experts are saying that the third dose, the booster, it's vital to protect you and your loved ones against COVID, and particularly the Omicron variant, which will prevent the most serious illness for COVID-19. In terms of eligibility, if you're 18 years and over, you are eligible for a third dose if you've already received your first and second doses and 4 months have elapsed. Severely immunocompromised people aged 12 and over are strongly encouraged to also receive their third shot as part of the primary course of the COVID-19 vaccination. I encourage you all to book on Roll Up for WA, where all the details are there about your vaccination status and preparation. Today there are long queues at the state-run clinics, and also be reminded that the GPs and the pharmacies are also available for people who wish and need to get vaccinated. It's hot weather today, so I'm strongly encouraging you to get a booking. It's expected that the queues will result in some people being turned away today. I've just received a briefing, and I know that some people are being turned away because they don't have a booking. So we're seeing a big surge in demand, which on one hand is a good thing, but what we don't want is to overwhelm the system and people getting frustrated. Yesterday there were over 540,000 people eligible for their third dose. So our clinics have the capacity, they've got sufficient supply, but we've got to manage this in an orderly way. And so what I'm strongly saying to people is that, by way of example, 15,000 appointments are available at the state-run clinics tomorrow, but there's only 19%, 1 in 5 people have actually made a booking. So it's far more orderly and efficient. Over the next 2 weeks, there's 180,000 appointments available. Again, only 17% of people have made a booking. So it makes a lot of common sense if you get on to the website, make a booking, and we can manage the queues that are there in a much more efficient and safe way. Don't forget again to take up the opportunity to go to a GP and or a pharmacy. So the vaccine supply is adequate, and we'll continue to work our way through that. Happy to take questions.
The 3 local cases linked to the Delta cluster, 2 of them infectious in the community, 1 of them linked to the Lucky Shag. Is the other linked to another hostel in Fremantle?
Look, I don't have that information with me, I'm sorry.
There's people who've been removed from the Sundancer hostel in Fremantle overnight.
I know our contact tracers are working through, and Sundancer was mentioned in a briefing this morning. So I'm quite confident that the Department of Health contact tracers, assisted by police as well, are working their way through any people that may be connected with that particular premises, and they'll be notified. If you're uncertain, then make contact with the Department of Health, and if you've been in and around there. But we're working our way through that as quickly as we can.
Was a positive case reported? Was a positive case staying at that hostel, or is it just contacts?
I personally don't have that information with me, so I know that the Sundancer is a premises of interest. As to whether the infected person was resident there, how long they'd been there, I simply don't have that information, but we'll make contact. Please check our websites though, in terms of the exposure sites, the time and date.
Do you know how long those 2 people were infectious in the community?
No, I don't.
How were they identified by contact tracers? Did they come forward willingly to be tested, or were they tracked down by contact tracers?
Look, again, I don't have that information with me. What we are asking people is that if you're symptomatic and you've been at any of those places, please come forward and get tested. I don't have the particulars with me in terms of, 1, how long they'd been in the community, and 2, how it came to be that we'd identified those people.
Do you have any more information about the Broome case? Or you said it was an offshore worker, I think, and also, is the airport not an exposure site if that was someone going back to Queensland?
Look, I'm sorry, I don't know
Yeah,
whether the
I
acting
can-
Premier might be able to answer that question shortly.
Do we know how the 3 are linked to the backpacker cluster, where they are suspected of being infected?
Look, I don't have those particulars, Jess, with me. What we do know is that there are what are classified as close contacts, but then there are secondary and tertiary contacts. So it's such is the case with COVID-19 that people who are in the same place for a particular period of time can get infected, clearly from other people, and it's not just the primary, what they call index case, it'll be secondary, and people at times are tertiary contacts as well.
So they weren't close contacts?
I don't have that information, I'm sorry.
When were these cases discovered, the 3 backpacker links?
They were reported in the overnight reports, so as to exactly when, the acting Premier might have more information, but I simply don't have that detail.
And that hotel quarantine guard in the Hyatt, I think it was, the Pampac one, the theory is that it's spread from people opening the doors without masks on. Is that the theory for this one as well?
Again, that's subject of the investigation. Certainly in the Pampac, the CCTV review indicated that several doors had been opened by the occupants. Look, for fire mitigation and safety reasons, we have to keep those doors closed but unlocked at times, but infrequently. People have opened those doors. That's certainly a key part of that investigation by the health officials. It appears that that is probably the way it occurred, but you can't be so precise and definitive about this. What we do know is that the security guard at all times was appropriately wearing the PPE, which included a face mask as well.
The Pampac one?
Yes, that's right.
And the
And
Hyatt
the
one?
Hyatt?
I don't have any more information about the Hyatt. I know it's subject of their investigation.
So
Do you know how
variant
many-
not known yet?
The variant is known. As I understand, it's Omicron.
Hyatt
That's
for the
for
Hyatt
Hyatt or
worker.
The Pampac.
The Pampac.
Yeah, we
But
haven't
what about
done-
the Hyatt
We
worker?
don't have the
we
Hyatt
haven't done
result
the
yet.
genomic sequencing.
Did you
How
know
concerned are you at the ongoing trickle of cases from the backpacker cluster?
Well, look, the Chief Health Officer has expressed some concern that, look, there's appears to be at least some small number still in the community. I'll put that in a context, and this is not an excuse. The reality of it is over 64,000 cases have been reported across the rest of Australia. What we do know clearly, and the health officials are advising us, is the Omicron variant is in fact far more contagious in terms of its transmissibility. In this case, it's Delta, and so with the backpacker cluster, fortunately that's not Omicron, but at the same time there does appear to be at least several people in the community who we've been attempting to contact. And as you know, in the mess hall, over 503 people were identified as being present there. The team have done a tremendous job in tracking down all those people, but of course we've had some secondary and tertiary exposures where people have gone back to various places and passed it on to others. So look, the whole effort has been ongoing, and it will continue, and we'll continue to endeavour to collect as much information as possible. But again, we're putting the message out to the community. If you're symptomatic, then and you've been in and around any of these exposure sites, please come in and get tested.
Do you know roughly how many interstate arrivals are currently in home quarantine?
Look, it's in the order of about 3,000. I don't have the information right with me here and now.
And they would have arrived in the last couple of weeks from the state?
Or look, ordinarily, yes, there's a 14-day period clearly of people in self-quarantine. We've been hovering around about 3,000 people consistently for, well, I reckon, about a year now, that people have been monitored in self-quarantine. It is now a requirement that people have to use the GTG Now app, and that's a really good, efficient way of monitoring people in home quarantine. I did it myself for a short period of time. The system works quite well, and what we have found is that of the thousands of people that have been doing that, we haven't had any breaches of any note of concern. So it's quite a good, sound, robust system.
And that fifth case is that's a household contact of an existing case. Can you provide any more information?
Not beyond what we've already said.
One of the exposure sites listed was Yagan Square on New Year's Eve with fireworks celebrations. Given obviously masks weren't mandated in that setting, and I guess check-in might have been a bit different in that. Well, what's the level of concern for that site, if any?
Look, nothing beyond what we have already made very public. Again, we just want people to continue to monitor exposure sites. We saw some of the southwest down in the Busselton-Dunsborough area. As I understand and been briefed, in that case, one person had been down to a particular sites there, but in places like Yagan Square, thousands of people go in and out. So, you know, we've got this in a West Australian context. I mean, if you're asking the same question of officials in Sydney, Melbourne, they'd be nonplussed at these sorts of questions because it's just rife through the community. So what we're doing here is tracking and tracing as many people as we can, and we're clearly wanting to try and suppress and stop Omicron running rampant through our communities. So while this is going on, we're putting a lot of effort into making the vaccines available, and clearly as we go up towards the 5th of February, we want to get as many people vaccinated as possible. The tracking and tracing team are doing a tremendous job, and we're not getting many infections. There are some, but we're getting right on top of them, but there is just this vestige of small cases in the community that we just want people to come forward and get tested.
With regard to the Pan Pacific security guard, do you know how many positive cases are quarantined in the Pan Pacific and how many of them are Omicron?
Look, I don't have that information exactly with me. It's in the order of about 30 odd cases. They're not all Omicron, some are Delta, but they're all being managed in isolation. And so that's been quite normal for the last 2 years. We've generally had people coming in from overseas. We've now seen in the recent days flights from both Queensland and Tasmania, which have had multiple numbers of interstate people coming now. So we're seeing far more, obviously because of the spread in the eastern states, many more interstate arrivals now with COVID-19. We were hardly getting any before, but I think what we're now seeing, and that's why the Chief Health Officer has advised us to put Tasmanian ACT to extreme, again because he's got public health concerns, as we all have, about the prevalence of COVID-19 in the other jurisdictions. So it'll mean less people coming in, which means less infected people coming in.
There's been no spread detected from the PAMPAC guard in the community. Is it suspected that any of the people in that hotel might have caught it from him?
No, I don't have any of that information. In regard to the guard, again, we're satisfied that he took all the right PPE measures. He didn't go out and about in the community much. He went to Murdoch Uni, one other place, and basically went home and then came back to work. And because of the regular testing, we're able to get on top of that one quite early. So he simply did the right thing. He unwittingly got caught with the infection, but in all other respects, he's done exactly the right thing, hasn't been out in the community much, and we've got early warning.
The reason I ask is other guests inside the Pan Pacific are having specially arranged out of quarantine end-of-life visits cancelled because they're being told there's an increased health risk this morning. Can you shed any light as to what the increased risk is and why pre-arranged visitations are being cancelled?
It's the first I've heard of it, so I don't have any information to add.
How many West Australians will be eligible for their third dose by February 5?
Look, I don't have the exact information with me beyond what I've said already. Today, or in fact as of yesterday, 540,000 people are eligible for their third dose. That's the figure as of yesterday. What you will see is that on the 31st of January, there'll be another cohort of people, and I was in an information session this morning with the Commonwealth. That's about an extra 4 million Australians. So over yesterday's deadline of 4 months and to the 31st of January, that'll be a total of 8 million more Australians that'll be eligible. As to how many are West Australians, I don't have that breakdown other than the 540,000.
How confident are you that we'll get to February 5 without Omicron running rife, given we've had 2 guards now in 3 days test positive?
Yeah, look, that's a tempting one for me to answer. I wouldn't share a lot of confidence that we'll keep Omicron out because we've already, got it here. So to totally eradicate it, I think would be fanciful. So I would strongly encourage people to get vaccinated. There are still some people, surprisingly, that over 2,000 presented at the state clinics yesterday for their very first dose. So, we've been very consistent now since February last year. The vaccine's available, go and get vaccinated. What we do know, and it is very compelling, is that the third dose is particularly important in the extra layer of protection for the Omicron variant. But there are still some people in our community that haven't had a first dose. So, I repeat our strong request for people, in order to protect you and your loved ones, get vaccinated.
Do we know if the returned traveller whose household contact has tested positive, do we know what strain of COVID they have, and whether or not the household contact had been out in the community?
No, I don't have any information on that, I'm sorry.
So if there's say less than half of the population eligible for their third dose by February 5, I mean it's 500 and something thousand now, I can't imagine it'd be day by day that I guess there'd be a few more added to that. How can we continue with the February 5 date?
So the Chief Health Officer has advised, and the government have made very clear the announcement that by February 5 the target date is 90% double dosed. Now that is what the Chief Health Officer advises, and that's based on the AHPPC and the national approach, that for people 12 years and up, 2 doses at 90%. Now
but then you've got Omicron.
Let me finish. We will achieve that well before the 5th of February, so that is the target date. Now, we didn't know about Omicron until about 5 weeks ago. So this is why, based on health advice, we're asking people to get a third booster in order that you can get the best layer of protection. But the official position, both at National Cabinet and at state level, is that 2 doses at 90% is the target set for the 90th, and we will achieve that.
That's a bit of a step change, isn't it, from yourself and the government have been pretty controlled with how they've approached this virus and pretty cautious. So you're saying that, and health experts are saying that a third dose is the most effective against Omicron, but then, we're still heading towards this 90% target. How do you explain that? So
we always base it on Chief Health Officer's advice. The Chief Health Officer has not changed his advice. We're encouraging people to take the third dose. That's what the health experts are telling us. But the official position is 90% double dose is what the Chief Health Officer's advice is. Should it be that nationally they take it up to a third, and they have not done that, these sort of matters are discussed at National Cabinet level. It has not been considered, and nor have I received any advice that a third would be mandatory in order to be eligible, if I put it that way. So unless we get the health advice to say so, we'll follow what the Chief Health Officer says.
Is there any new modelling being created? I mean, this has been, I think it was more than a fortnight ago, the Premier said that he would wait a fortnight to see what happens in New South Wales. We can see what's happening over there at the moment, cases relative to hospitalisations, all that kind of stuff. Have you seen any new modelling to guide our way out of this?
I can assure you the Chief Health Officer is looking at this daily, and he's in constant contact with his other Australian colleagues on the AHPPC. When the position of the health advice changes, I'm sure he'll let us know. But at this point in time, the advice he's given us, we're following.
Those double dose targets that are the centrepiece of the national plan and WA's border date and so forth, they're all based on substantial TTIQ as well, though, aren't they, which has essentially been abandoned in New South Wales?
Not by WA.
but in New South Wales. So is it hard then to keep track of spread post February 5 and the movements of the virus?
Well, my comment to that is not to defend a policy position, is to say I try and, by example, do what we're asking other West Australians. If we're advised to wear a mask in certain areas, wear a mask. If you want to protect yourself and your loved ones, get yourself vaccinated, wear a mask when it is advised to do so, and make sure we keep track by using your QR codes. That's what that's all about. If you've actually travelled, yes, you will have to isolate, whether it's in a hotel or at home. They are the sorts of TTIQ measures that we've had in place for a long period of time. What we're adhering to in WA is following the best health advice. It's served to protect us extremely well over the last 2 years. That's why we're under 20 cases reported today with 64,000 in the rest of Australia. That's not to skite, and that's not to be arrogant about it. The reality of it is we've been extremely cautious based on the health advice. So we'll continue to maintain that and do that for the best interest of all West Australians.
And just to clarify, there's been mention in court this morning apparently of some new COVID rules coming into effect today that have affected prisoner movements. Are there any new rules coming in today?
I've not heard of that at all.
So there's no restrictions, changes as a result of these 5 new local cases today?
No, I've not been briefed on that at all.
Just a quick one, sorry Commissioner Lee, just a quick one. Police matters, the man charged over the kidnapping of Carol Lyle. Could you just share your reaction to that one and perhaps an update on how she's going?
Yeah, so look, it's a very sad case. So the allegation that we've put before the court, and the man's appearing in court today, I think from memory he's an 80-year-old man, is that the woman was unlawfully taken from the place that she's been cared for, and she's not a well woman, she's an 84-year-old woman. Look, they were located by police near Warracoona, which is right in the central desert. It's about an hour from the Northern Territory border. The information we had was that they were heading to Queensland. Look, she's not in good health, but she has been flown by RFDS. The information I have this morning is that she's been returned to care in the Peel area, and she's under good care now, and her condition is stable, as I understand. Okay, thank you.
Given the confirmation now of Omicron from the hotel quarantine worker,
Yep.
should we be expecting to see, I guess, a surge in cases over the next few days?
Well, obviously Omicron is the COVID-19 curveball that we're all dealing with, both here, elsewhere in Australia and abroad. So we'll continue to have to monitor the progress of the disease and make sure that we can respond to it. I think we are in a good position in that we are in a position to really learn from what's going on in the East Coast, and that's one of the advantages of opening up later than the other states. We can see how they're continuing to pivot to make sure that they can adapt to the new and changing conditions, and we can learn from that. So that's obviously a good thing.
Are we likely to be wearing masks post-Friday, given these new cases that keep coming out? When will the decision be made on restrictions?
Well, we'll receive health advice, obviously, towards the end of this week. But I think your reading of it and my reading of it would be that we need to continue to be cautious. But we'll make a formal announcement with regards to that. It obviously depends on how we continue to see cases roll out over the next few days. It's pleasing that the overwhelming number of cases that we've reported today are in quarantine, either at home or in hotels. And so we're continuing to stay on top of these particular incidents.
And do you share the Police Commissioner's view that we're not likely to get to February 5 without Omicron taking off?
Well, Omicron is taking off. We have it in our hotels. We have it in some home quarantine situations. What we need to do is make sure that how we respond to Omicron doesn't impact on the rest of the community and in an adverse way. And that's been always our game plan as we've moved along. and we'll continue to make sure that we can have the best vigilance in terms of any outbreak of the disease and make sure that we can continue to respond to any risk.
There's no
Just more
evidence of
information on
spread
the
yet,
broom
though.
case.
Isn't that an important perspective? I mean, there's no evidence of any community transmission from the hotel guard as yet. Close contacts have tested negative. It was
No.
picked up so quickly that there would be high hope that it's contained.
Yeah, so and that's a really good example of how the measures we put in place have continued to keep the Western Australian public safe. The daily testing that we have for all our hotel quarantine workers means that we picked up these cases very early on in their times. The working theory is that the hotel security guard acquired the disease from one of the guests at the hotel, so that is a case of community spread. But we need to continue to investigate that just to verify that that's the actual process of transmission. But it is an example of how Omicron is in our lives today. And that's why we're continuing to put these measures in place.
Is it
Does that mean
suspected the
that-
Hyatt guard has Omicron as well?
Look, we're very early days on the Hyatt guard, and we just really need to wait till the contact tracers have had an opportunity to really understand the full extent of that incident.
Are
Does
there
this mean
other
that the
Omicron-
hotel-
case and why is the airport not being exposure site?
Yeah, so the advice that we have in the Broome case, and it is very early days at this point in time, is that it was a case that related to a person who was working offshore. They spent a very short period of time at the Divers Tavern, and in fact that is a very low risk incident. We don't require people who are there at the same time to get themselves tested and isolating. We're simply asking them to monitor their symptoms with heightened alertness to make sure that they are monitoring their own situation. So at this stage, that's the only exposure sites we've been advised of. So, and I don't have the full details of how we travelled on from Broome.
With the hotel quarantine, we're already spacing apart people. We've cut our cap down to 260, I think it is. There's all these measures in place, ventilation. We pick the best hotels we can, and guards are still getting COVID. Does this kind of make the hotel quarantine system irrelevant in an Omicron era? And are you thinking that maybe home isolation, or will this impact that kind of decision making when we do finally open up?
Well, certainly any response that we have in terms of how we manage our quarantine hotels is based upon the best health advice. I think at this stage the hotel system is working very well, particularly through the reduced caps that we have, and that's enabled us to keep people safe. But we need to investigate these two cases thoroughly and just make sure we understand if there's been any shortfall or shortcomings in relation to the way that those cases were handled. I would just stress once again, the reason why we know about these cases is because of the measures that we have in place in relation to daily testing, and that's why we've been able to limit any risk associated with these two particular cases.
Can you update us on WA's stance on, or I guess position in terms of rapid antigen tests? Do we have more than 8 million on order now, or is it still 8 million by Feb 5? And also, what's WA's position on cost sharing with the Commonwealth government? It's been discussed at National Cabinet today to set up, or I guess to give cash handouts up.
Yeah, so look, in relation to the discussions which are underway under National Cabinet, I don't obviously want to speculate or predict, the outcome in relation to that. In terms of the stocks on hand in Western Australia, we currently have 275,000 stock on hand. By the end of January, that will have increased to 5.1 million. And by the end of March, we anticipate having 20.5 million rapid antigen tests in Western Australia. That will be the government stocks. Obviously, there's a range of industries that are acquiring the devices as well. So we expect Western Australia to be in a strong position in relation to availability of rapid antigen tests.
And when will they be available to the public?
So next week, as I said, as I foreshadowed, the Chief Health Officer will remove the banning on the use of rapid antigen tests, and we'll have further comments to make in relation to the guidelines which will sit over that regime later this week.
What was
Do you
the
believe they
change
should
to
be
that?
free?
Only on Monday, the Health Minister said that rat testing wouldn't be brought out while COVID wasn't in the WA community. I know we have a small outbreak, but she predicted that it wouldn't be brought in much sooner than the February 5 date?
Well, that's why we will be providing more details in relation to the Chief Health Officer's advice in the way that we will see a rapid antigen test rolled out in Western Australia. Obviously, we're all anticipating that that will be a part of the regime going forward, but we need to make sure that we do this in a way which doesn't undermine our capacity to monitor the disease and respond to the disease. So I just want to take you through a scenario. Say someone gets themselves a rapid antigen test that comes up with a positive, and they choose to keep that information to themselves. They might be doing the right thing, but might be isolating to the best that they can. But unless we as a government and as a WA health team know about it, we can't advise that person on how to respond. We can't then do contact tracing in relation to that person. So it's important that we can identify all positive cases through the PCR and official testing regimes. And we'll have more to say later this week in relation to the rollout of rapid antigen tests in Western Australia.
Is WA's PCR testing capability being upgraded ahead of Feb 5? We've seen huge queues over Eastern. It takes 4 or 5 days for a result to come back.
My understanding is that is the case. You'll see certainly longer hours. You will see a greater collaboration with our private pathology clinics to make sure that we have the capacity. It would appear from what's going on in the East Coast is that as you see a sharp escalation in positives as a result of Omicron, that puts our traditional testing regimes under a lot of pressure. That's one of the reasons why rapid antigen tests has become absolutely germane to our response, and that's why we are awaiting final advice from the Chief Health Officer on how we should consider that as part of our regime into the future.
You mentioned one of the benefits of waiting till February 5 to open is to monitor what's happening in other states. As cases continue to grow, we see changes to both testing and quarantine rules very quickly. Do you think these National Cabinet meetings are ones the Premier should be missing?
Well, look, it's not unusual for a Premier not to be at a National Cabinet meeting. It happens from time to time. Obviously, we have people in the room, and we are obviously witness and can monitor those conversations. It is a fact of life that COVID-19 has been with us for a good 24 months now and will continue to be with us for some time yet. So from time to time, not everyone will be in the room to make these decisions. That's why we trust in the governance arrangements.
Is the Premier and the Health Minister presumably still on the phone to yourself, the Commissioner, frequently, and was his leave actually delayed initially because of the backpacker cluster as well?
Well, yeah. My understanding is he did delay it for a very short period of time. Although we're very keen to make sure that the Premier and the Health Minister, like all Western Australians, have a few days to spend with their family during this time of the year. And I think all Western Australians would appreciate that giving them a couple of days off. A few days off is an important part of making sure that they are ready and ready for the fight when they come back to work. Very short period of time.
We published a letter this morning from a doctor working at a major hospital in Perth, and she said, no matter how hard you work to convince the general public that you've done all you can to prepare, I can tell you fundamentally, as someone who works in that system every day, that we are not. And she goes on to warn that it's going to be lots of deaths, but the systems can't cope with COVID. We're not actually ready, are we? Our hospitals aren't ready to deal with this tidal wave of cases.
Well, look, can I just say that we've set up the health system to be ready for COVID, and one of the observations that I think was made in that letter is that there's not enough beds, and through both our budget allocation and through our mid-review allocation, we have invested in an extra $3.2 billion in our health system to make sure that we are COVID ready. That includes 570 new beds. And 80 of those will come online in just the next month, so by February. That includes a 36-bed allocation at one of our private hospitals. We are recruiting more doctors and nurses than we have ever done. And as part of that allocation, you will see another 810 nurses employed and many hundreds of doctors as well. So we are continuing to invest in our health system, and a lack of resources is no impediment in terms of the way that we are responding. We know that every health system in the world, has struggled over the last 24 months. and ours is no different. But what we can do is invest heavily, take the time that our management of COVID-19 has provided us to recruit more doctors and nurses, and be as ready as we can be for when Omicron comes to our shores.
Why are
Last
the doctors
question.
saying that nurses and doctors are working triple shifts over the holiday period, and she's going home crying because they're unable to provide the care to the patients that they deserve?
All doctors and nurses, everyone working on our front line, are doing an extraordinary job under very trying circumstances. We've had an increase in the demand on our hospital system. That's the same as we've seen across all of Australia. We've seen significant constraints in terms of our healthcare worker availability, particularly in relation to nurses and doctors. And that's why we've put so much effort to make sure that we have the extra beds, that we have the extra doctors and the extra nurses. Over 1,200 newly qualified nurses and midwives have been engaged for this year alone. So we are making the changes, making the investments, which will enable us to respond to it. But I'm not saying it's not going to be hard. It is going to be hard. And the people that are doing it the toughest are those working on the front line. And on behalf of all Western Australians, we thank them for their efforts, we thank them for their care, and we thank them for keeping us safe.
Whose job is on the line if our hospitals can't cope?
Look, everyone's job is on the line in response to COVID-19. It doesn't matter whether you're a doctor or a nurse working on the front line,
But from government,
whether you're a health leader, or whether you're people working in our COVID vaccination centres or oversighting them, or our testing centres. This is an overall effort by everyone in the community to make sure that we can continue to fight and respond to COVID-19.
Just on end-of-life visits outside hotel quarantine, I mean, how difficult are they to manage the risk? How much effort is being made to make them happen in a safe way? And is there an undertaking to try and make, I know you don't know the specifics of the case I'm talking about, but is there an undertaking to try and make end-of-life visits happen if someone's close to death?
Yeah. Look, and as you say, I don't know the specific circumstances that you're referring to, but I do know that everyone in the health teams do their very best to bring a compassionate response to the way we manage the system. Obviously, keeping everyone safe is our overriding concern, but we do take a compassionate approach to make sure people in those very sad circumstances can receive extra attention and care. Thank you very much.
One non-COVID. Up in Wickham, Minister, apologies, but up in Wickham, I'm not sure if either of you have seen a Christmas Eve celebration that's been going on there for 30 years, went viral online this week with regard to fire trucks spraying their hoses at kids, and the police up there having a bit of a party and a bit of a play fight with the kids. It's apparently an annual tradition that's incredibly popular and has now been cancelled by DFIS after publicity because of health concerns. Is bureaucracy becoming a bit of a party pooper, and can that be reviewed?
Look, we need to keep people safe, and we need to make sure that every department conducts themselves in a way which is safe not only for people who work within the department or the community that they serve. So I don't know the circumstances, but obviously I'm sure they've taken the best advice in relation to managing that arrangement.
Spraying a hose at kids seems pretty harmless.
Well, it depends how powerful the hose is, I suppose. But thank you very much, everyone.
Thank you.
Thanks.
Thanks.